My name is Alan Harris. I'm the Emergency Management Director for Seminole County. We wanted to give you an update. This will be about an hour presentation. So you'll hear from, of course, myself about Seminole County, what our plans are, how we plan to progress as we learn more about COVID-19 and learn more about cases as they come into the community. And then we'll hear from Donna Walsh. Donna Walsh is the director for the Florida Department of Health, Seminole County. And then we'll hear from Kevin Baker. Kevin Baker is the epidemiologist manager for Seminole County and overseeing the epidemiology of COVID-19 here in the county. We've been working closely together with the Seminole County Sheriff's Office and Seminole County Fire Department since January, actually, of this year. And we've been doing a lot of work to prepare for COVID-19. We used some of the plans that we had developed during Ebola. So while this is a very different type of virus than Ebola, we used that as a basis for our planning purposes, and of course we modified it to be more for the COVID-19 strain of coronavirus. Currently in the state of Florida, just so everyone gets a good understanding, and I know this changes daily, and whenever you wake up in the morning, if you turn on the news, you hear a new group of individuals that have tested positive in the state of Florida, but currently we have 29 confirmed cases in the county. I'm sorry, in the state of Florida, not in the county, in the state of Florida. Some of those individuals include non-Florida residents, so non-Florida residents that are in the county. There's 3 of those individuals, I keep saying in the county, in the state of Florida. So those individuals either were traveling here or they came to Florida for some reason, and now they are here with confirmed case of COVID-19. So they're in those individual counties being taken care of. In Seminole County, we have currently no confirmed cases of COVID-19 in our county. We are testing individuals, as we have been since we heard about the virus, and as individuals come back from their travels. We're a wonderful community here in Central Florida. I know you all travel and I travel, and I just canceled my cruise that was scheduled a couple weeks from now. Didn't think it was a good idea as the Director of Emergency Management to go on a cruise at this point. But we do travel, of course, and individuals are coming back home, and they have been coming back home, and as they come back home, if they get signs and symptoms of COVID-19, the Florida Department of Health has been testing those individuals and doing a great job with that. The incident management team has come together to develop an incident action plan. So I want to tell you a little bit about what the county is doing. The incident action plan includes how we will isolate and quarantine individuals in their homes. That includes food delivery to make sure that they can stay at home so they don't have to go to the grocery store. That's part of the plan. We've tried to think of every possibility. Medication, so if someone's isolating at in their home and they need their heart medication or insulin or something like that, to get those services to them. We've gotten down to the point where if the individual is sick and goes to the hospital and has a cat or dog, who's going to take care of the cat or dog? And how can the veterinary staff at animal services isolate that animal and also wear personal protective equipment to take care of that animal? Because we wanted to make sure that all the different things were covered related to the response and the quarantine and the isolation. One of our main goals, all of us, and they'll say it as well, is to try to prevent the spread of this virus. We want to stop it if we can, and part of that is through isolation and quarantine methods. We have been pushing a lot of public information and protective measures, and we've been doing a lot of protective measures across the county. That includes government buildings, courthouses, libraries, things like that. So all of those facilities now have hand sanitizing stations. They have enhanced cleaning services and things like that to protect the individuals that come and visit our public buildings all the time. And this actually changed overnight, right? So as you know, we did have an update to travel a couple days ago, and that was for level 3 countries. So level 3 countries, level 4 country would be China and Iran, which we're not allowing travel at all. But level 3 countries would be Italy, Mongolia, South Korea, and there's a few others. As those individuals are coming into the country, they're asked to self-isolate in their home for 14 days. Level 2 countries, according to the CDC and the State Department, that would be like Hong Kong, Japan. They're asking to self-monitor themselves for 14 days, and if they start to get any signs or symptoms, to contact the Florida Department of Health quickly so that they can be tested. Those travel restrictions change all the time. And last night, they changed again. So last night, if you watched the president speak, now we have a 30-day ban on European travel, and that's foreign nationals coming into the United States. That's not US citizens. So if you have a United States passport, you can still come home from France or Italy or wherever you are. But for foreign nationals coming home, there is now a ban, a 30-day ban on European travel. That does not include the United Kingdom and Ireland. So it's important to look at the different countries that are there. And I know that I read some news reports, CNN, Fox News, MSNBC, and it's very interesting when you read those news articles, the differences. So I would encourage you to go to the State Department to read the information, because in some of the newscasts, it sounds like all travel from Europe, even if you're a United States citizen, that you can't come back home, and that's not the case. So read that very carefully. As I said, we put hand sanitizing stations all over. We've been pushing the message of sanitation and being clean and trying to prevent the spread of the virus. We are encouraging individuals that are sick to not go to any public gathering location. Please don't go to work sick. I'm sure in your businesses, and I'm guilty, we're guilty, in the government as well, you hear, oh, we spread the whatever it is around the office again, or something like that. That is not an acceptable practice. That's certainly not an acceptable practice with COVID-19. So we're asking folks, if you are sick, please stay at home, please don't come to work. Please don't go to school, please don't go to church, please don't go to concerts, sporting events, things like that. The county right now has not limited any special event at this time. We do have thresholds where we're going to start to make those decisions. So as we start to see more cases in the county, those decisions will start to be made. And of course, we'll start with larger gathering locations, concerts and things like that, and then we will get into the smaller type of special events as the numbers and the cases grow. But at this point, no ban on no concern of any public gathering. There were some concerns about, we heard some concerns, and I don't know if you read, if you heard about this on social media or something like that. We did receive some concerns on social media about this presentation here. It is safe to be at Seminole State College. There are students today that are learning right upstairs. They're having their lunches in the lunchroom. This is a very clean college. It is okay to be at the University of Central Florida today. It is okay for those students to go to college. It is okay for those students to have lunch. It is okay for you to have lunch here. So we want to, and that's one of the reasons, and Donna and I talked about this. I said, you know, it's actually really good that I saw these comments, because I know how important this is. Because if people are afraid to come to something like this right now, then we need to put out a different type of message. Now, in the future, if we see a lot more cases, then we may not do something like this. We may look more at like a video, something like that presentation. But at this point, no confirmed cases in Seminole County, not one. We have 450,000, a little over that, right? 470-something thousand people now in our county, and we have no confirmed cases. So we don't need to limit gathering. It's okay to go to church. It's okay to go to school. It's okay to be here at the college. We have a business workshop that's coming up. We've been doing a lot of workshops like this one here. We did a workshop with our faith leaders actually 1 week ago. We had 96 organizations that showed up to that. It was really a great presentation. I'll talk a little bit on the next slide about what we talked about there, but on the business side, we wanted to talk to the business leaders about continuity of operation planning. So if you start to see a large number of individuals get sick, okay, in the community, you need to think about how we continue operations. How can you continue operations if 10% or 20% of your workforce is unable to come to work? Those are questions that need to be discussed. Can individuals work from home? Is there a method for working from home and using their computers? What type of technology would they need to do that? Those are things we want people to start considering at this time. Work at home policies, sick leave, things like that. I know a lot of times people come to work sick because there's no sick leave or there's no PTO, paid time off. So those are things we want business leaders to think about. As I discussed last week, we want faith leaders to think about how they're going to continue to provide sermons. How are they going to continue to touch their congregation? They may want to do that over video. They may want to do that over TV. Again, we are not limiting public gatherings at this time. But if we start to see a large number of cases, we may have to do something like that, or the governor may have to do something like that. The governor did do that in the state of Washington. In the state of Washington, now the highest number of attendees at any one location is 250. So churches, mega churches, are now having to rethink how they provide messages to their congregations. And we want the faith leaders to think about that now. The collection plate, the tithe plate, that goes by my pew every Sunday. And as people goes around the church, it's very interesting. I didn't notice until COVID-19 how many people cough in church. But they cough, they grab the tithe plate, and then they pass it down to me. So we want faith leaders to think about how to do collections a different way. Communion. We, in my church, we pass around a little thing with little bread. And then the person next to me touches 5 or 6 pieces while they pick their one. And then I touch mine and touch 15 or other pieces. And if you're in the back pew, every single piece has been touched a couple times. So we want to think about how we do that or how we don't do that, right? Instead of handshakes and hugs, we do hugs at my church. Instead of hugs, we're doing fist bumps. And even the pastor said, we're not hugging anymore, we still love each other, but we're gonna do fist bumps from now on, so we do fist bumps. We have seen some, once we decided fist bumps was the thing to do, then of course, the next day something came out that said, well, fist bumps aren't good too. It's better than a handshake, right? And it's certainly better than a hug, so we're still doing the fist bumps. So. Testing procedures. We had a lot of questions on labs and tests and stuff like that. Right now, the private labs are still gearing up, all right? So we're at a point now where we are testing at the Florida Department of Health. Please don't everyone run out to the Florida Department of Health to go get tested. And there's a lot of worried well people. They get the common cold, and because they've seen COVID-19 on the news over and over and over again, they say, oh, I got COVID-19. I want to get tested. Well, if you didn't travel anywhere, you don't meet any guidelines, you don't really have the conditions for COVID-19, maybe you don't need that test. There's a limited number of tests that are out there. But we are seeing that the private labs are starting to come online. Hospitals are working to come online as quickly as possible. We anticipate about a week or so, maybe week and a half, 2 weeks, we should start seeing private labs across Central Florida offering the service. Obviously, nursing homes and ALFs, assisted living facilities, are a big focus for us. We saw what happened up in the state of Washington. We've seen what's happened across other parts of the country and other parts of the world. Next week, we're meeting with, I think we have over 80 now facilities that are registered. Higher, good. administrators from assisted living facilities and nursing homes that are going to be coming to our emergency operation to talk about how they can protect their clients. The most vulnerable individuals, other than those that are immune compromised, that we see across the country. We want to make sure that they're safe. So Florida Department of Health, again, Kevin, Donna, and myself, and Stephen, are my senior planner. We'll be working with the ALS and nursing homes next Monday to talk about some of those things. Yesterday, an executive order went out that now family members will be asked certain questions prior to being allowed to come into the assisted living facilities and nursing homes to visit their family members, and that's a good thing. It's protecting those individuals from anyone that could come in and bring a virus with them. Schools have done an amazing job. If you have a school-age child, you've probably received at least 3 or 4 emails from Seminole County Public Schools on some of the protocols they're doing. They're wiping down the buses. Probably the buses are cleaner than they've ever been. You'll probably have lunch on the school bus. Probably wouldn't have wanted to do that before, but now you can. So, and they're also doing some enhanced cleaning up to twice a day in some schools. So they're doing a lot of great jobs on that. Yesterday, you saw the Florida Board of Governors put out a document to public universities. Everybody goes on spring break next week. We don't. Anyone else go on spring break? Any spring breakers? Oh, you do? Okay. Yeah. Doesn't happen in government. So I'm not jealous, but instead of the individuals, the students traveling and then coming right back and getting into classrooms, they are asking for public universities to hold for 2 weeks before in-person classes. So they're still going to do classes, everything's going to be online. Community colleges, other colleges like Seminole State, they're working through those systems right now to figure out exactly what they're going to do. They are governed by a different group than the Florida Board of Governors, so there may be some differences in that, as well as public schools. Public schools are working through those processes as well. But we wanted to let you know for public universities, the University of Central Florida being our closest public university, they won't have in-person classes for 2 weeks after spring break. The elections office, we've been working closely with the elections office. It is very safe to go vote next week. Probably be the cleanest polls ever. I spoke with Chris Anderson, our elections supervisor, just last week. They've done a great job. Is he here?
He's here. He's here.
Oh, yeah, there he is. I didn't even know you're, hey. So, I'm talking about you. So they have done an incredible job. I don't know if you want to say something. Okay, so they've done an incredible job. Polls were always clean. Okay, just saying. Okay, but we did verify last week, or actually earlier this week. None of our polling locations here in Seminole County are in assisted living facilities and nursing homes. Other counties are having to deal with that right now. They're trying to figure out what they're going to do because they have ALS and nursing homes that are also poll locations. You don't want people coming in and out of those establishments. So, but here it's very safe to go vote. Please go vote. Definitely execute your rights as a U.S. citizen to do that. Very safe and very clean to do so. I'll end with this and I'll ask Donna to come up. This is our contact information. PrepareSeminole.org is our website. If you can go to that website, there's a main page that says COVID-19. Click on that and it's got all kinds of information on everything that the county is doing, elections office, the school board, and such. For you for information purposes. And as things change, and they change daily? Hourly, that's true. Yesterday I worked on COVID-19 from 7 a.m. to 10:30. I hung up my phone. At that point I was in bed. I hung up my phone and went to sleep, and that was my last conversation of the night was COVID-19. So we are working very hard to keep our community safe. I'm going to ask Donna Walsh to come up, Director of the Florida Department of Health, Seminole County.
Thank you so much, Alan. And good afternoon, everybody. As Alan said, I've Donna Walsh. I'm the health officer, administrator here for the health department in Seminole. And many of the things that Alan just mentioned, I won't revisit all of those, but I will expand on some of those things for you and what the state is doing to help us to keep our communities safe. And we do stand ready every day. We've been talking about this, as Alan mentioned, since January when we first learned that there was coronavirus evident in China. And so we knew that we needed to look at our pandemic flu plans because some of the preparedness and response is very similar to what we would do in pandemic flu situations, although these are two different germs, two different organisms altogether, but very similar transmission. So as he mentioned, the hand washing is so important. If you're sick, stay home. I know that we in Seminole County are very responsible citizens, and we want to go to work and help our community. But you're not helping your community if you spread this germ in your workplace or daycares or nursing homes. That's just helping others to get sick, and that's not a good thing. So just from a state perspective, our state, along with other state organizations, stood up an incident management team many weeks ago. It's a coordinated effort. So agencies such as AHCA, Agency for Healthcare Administration, our Department of Transportation, our Department of Elder Affairs, the Department of Education, all of these state agencies are working together in a coordinated effort to make sure that we keep our community safe on every level, as Alan mentioned. We also just started this week daily press releases as we are starting to receive reports from counties identifying cases in their counties. And he already gave an update, our most current information of 13 counties reporting positive cases with 29 Florida residents. And so you will see those press releases come out. They are available on the Department of Health website. Kevin Baker, our epidemiology manager, will give you that contact information, and you guys can take pictures too at the end of his presentation, so you'll know where to go to the CDC website as well as our Department of Health website. Department of Health, Epidemiology, Public Health always takes guidance from the federal agency. You all, I know, have heard this many times on the news, the Centers for Disease Control and Prevention. That is our guiding agency, along with our experts in Tallahassee, our state epidemiologists, our state surgeon general, and others help us throughout the county. In the state of Florida, we are an integrated system of health, which means that all 67 county health departments report to Tallahassee. We operate under very similar protocols, if not exactly the same protocols and procedures, adapting those to the needs of our community. So you will see that we have a unified response throughout the state. This isn't the case in a lot of states. A lot of states have local boards of health. We always coordinate our efforts, of course, with the county. We were responsible to the counties we serve, and so our communications are frequent and often, with our county leaders as well as emergency management. You'll also see many guidance documents come out on the CDC website along with the Florida Department of Health. There are a lot. It's overwhelming if you go to the CDC website and go, where do I start? They have a search engine there, if you have a particular topic. But if you were to scroll down to the bottom of that page, the CDC has been good about identifying what are the newest guidance documents for that day that you might see. So if you've been looking at that frequently, you'll see those. As Alan mentioned, this particular organism, coronavirus, there's 4 different strains that we've been familiar with impacting humans over the years. One of those is the common cold. What we're seeing today that originated in Wuhan, China, and is spread throughout the mainland China is what they call a novel coronavirus. Just as, I don't know if many of you remember 2003 when we had this severe acute respiratory syndrome, or SARS. They're calling this SARS-2. It's not quite the same strain. MERS-CoV, I don't know if many of you remember MERS-CoV. Again, a novel coronavirus, something we hadn't seen before. And Kevin will go into more detail about how that's transmitted from animals to humans and why we're seeing what we're seeing today. But the majority of the cases have been reported from China still, even though we're well over 100,000 cases reported worldwide. The majority of those 81,000 plus are still in China. The majority of the deaths still reported from China. As Alan mentioned, our most vulnerable populations, based on what's been occurring in China since December, and the epidemiology, is that those folks who are elderly, of course, and those folks who have chronic health conditions, diabetes, heart disease, suppressed immune systems, cancer, and so forth. Those are the folks that tend to develop complications from the virus and it can be fatal for those folks. That's why we want to protect our most vulnerable. Children can get the infection. There have been reports of children getting the infection, but they seem to get a very mild form of it. So so far, we're not seeing reports of complications in children. Of course, any child that has an underlying health condition or immune suppression, that would be a different story. But right now, we're just not seeing the complications that we are in the other populations that I mentioned. And so our state Surgeon General did declare a public health emergency on March 1st as we started to see evidence of the cases in our state and preparedness for that. And then our governor declared a state of emergency just recently, March 9th. And so what that does is that helps us to acquire resources that we need, whether it be personal protective equipment, hand hygiene, whatever the case may be. That helps us to acquire those resources very readily in our communities with the funding to support that. So we do have those in order. As Alan mentioned, the travel restrictions were kept up to date on those. He mentioned the travel 3 alerts, if you will, and that's the countries that he already talked about: China, Italy, Iran, South Korea. Are the ones that we're saying if no non-essential travel is recommended to those areas. If you don't need to go, don't go. Japan is level 2. Again, advisable not to go, but you're not restricted, of course. So those advisories are updated as they see more evidence of spread throughout the different countries. Another credible website to go to is WHO, the World Health Organization, and you will see a report of all of the countries and how many cases that they have. So if you are interested, you can go to the World Health Organization, and they have what they call a situation report that comes out every day that gives you an account of what's going on. What we're seeing right now is about 80 to 85% of people who contract this virus recover without complications. They do just fine. We are following folks, as Alan also mentioned, who are returning from those countries, that have the level 3. Throughout the United States, there are 22 quarantine stations. 11 quarantine stations are stood up for folks from China originally to come through for assessments. And if those travelers are well, they're allowed to go to their final destination, and they inform public health. CDC informs public health of that. We monitor those individuals and have been monitoring those individuals to make sure they stay healthy for that incubation period, which averages 2 to 14 days, so the full 14-day period. I am happy to report that so far, just the few that we have monitored, nobody has become ill. That's a good thing. But we are monitoring to make sure our community stays healthy. In the event that they do become ill, then we facilitate their visit to a hospital or a local healthcare provider to make sure appropriate protective equipment is utilized to protect those healthcare providers as they assess that individual, see if they need to go to the hospital or advise them on supportive care. At this point, there is no vaccine yet, although the scientists are developing or trying to develop one as quickly as they can to make it safe and effective. It's so important that the safety of that vaccine is held as we always do with any vaccine that's developed. So it averages about 12 to 18 months to develop a vaccine and go through the 3 clinical trials, the 3 stages of clinical trials. Like I said, they're trying to expedite this as best they can, keeping those safety measures in place. So the earliest that I've heard is perhaps by the end of this year, but it depends on what they find as they're developing the vaccine. As far as treatment, there are some compassionate care treatment that's been utilized throughout the world that seem to be effective, but again, at this time, they are getting FDA approval to make those readily available to everybody. So there are some small clinical trials going on right now in other countries as well to see if we can't get some effective treatment out there for folks to help ease their symptoms, especially those who are really having a difficult time breathing and are critical in the hospital. So at this point, I think I'm going to turn it over to our epidemiologist, Kevin Baker. He's going to go over with you some information that's being shared statewide And as Alan mentioned, this is, I have lost count, but we have been out in the community to groups such as yourself to raise awareness and education so that you are fully informed about what's going on. You know what we know. So, so that you can take precautions to protect your family, to protect your loved ones, and others you care about, in your community. And so we will be doing several presentations next week as well, and one this evening and one on the weekend. So we're 24/7, 7 days a week, 365. So I think you said you went to bed I think I went to bed about 1 o'clock, looking at the latest press release that came out after midnight from our state communications office on, reporting the most recent cases. So do we want to take questions now, or? Yes, ma'am.
Could we, I know the CDC yesterday said they were going to award $27 million to Florida, and we were wondering how you guys plan on spending the allotment that would come here.
Sure.
They gave us certain bullet points: epidemiology, surveillance lab, case identification, but how do you guys actually think you would put that into play here in Seminole County? Sure.
And we have thought of that. Once the president announced the funding that would come, as well as our state now announced funding that would come, we certainly could use resources in our epi team. We have 2 full-time epi folks, epidemiologists, and 1 epi manager. So in order to make sure that we're able to do those investigations and contact tracing and keep folks home, we would probably enhance our staffing. We're also looking at personal protective equipment, not only for our response at the health department, but for the community's response. So working with Alan Harris and the county, we want to make sure we have enough PPE in the event that our healthcare providers or our hospitals run low and they can't get it. So, so we would utilize some of the funding for that as well.
What about for the actual test, the COVID-19 test?
Sure. Well, so far, and let me just touch on the test. The Bureau of Public Health Laboratories, we have 3 in the state of Florida, 1 in Tampa, 1 in Jacksonville, and 1 in Miami. We don't have the capability of testing locally. All of the tests go to the Bureau of Public Laboratories, and they follow the CDC criteria at this moment because of, as you all have heard on the news, the test kits that have come from the CDC are limited, 75,000 across the nation. So, so we do follow that criteria. However, also, as Alan mentioned, the commercial labs are coming on board. LabCorp is now starting to test in our area. And Quest, we discovered by calling, recently here, we wanted to know when they would start here in the East Coast, because they have, some labs have started on the West Coast due to the numbers of cases reported in Washington and California and such. But so the test kits would become available through private laboratories. Whether or not the state is going to use some of those dollars for test kits, I could not answer that, but that is a possibility.
How many people are you guys monitoring at this point in Seminole County for COVID-19?
Right. Well, we're giving statewide information, so I can tell you a few. There's really not that many, but statewide, if you go on the state's website, you'll see how many people are being monitored statewide.
So we're going to hold questions just because we
Yes.
did say at 1 o'clock.
Yes.
And I know some people are going back to their businesses. So at 1 o'clock, we'll open up for as many questions, and we're also going to hang out. So, but
Yes.
I want Kevin to have plenty of time to go through his
Absolutely.
presentation.
So Kevin.
I appreciate it.
Yes. Kevin, go ahead and talk.
Okay, thank you. All right, good afternoon. All right, I'm just going to pull up my presentation here. Okay, so as I think mentioned a couple of times now, my name is Kevin Baker. I'm the Epidemiology Program Manager for the Florida Department of Health in Seminole County. For those that don't know exactly what epidemiology means, because I know it just is a really long word, we call it EPI for short. And what we're basically doing is taking in information about people that have various diseases and conditions across the state of Florida. In our county is where I focus. And so with COVID being a new disease, my program's responsibility is identifying people that meet criteria for testing, get information that we can try to prevent the spread of this disease within our county, as well as the state, nation, and the globe. So as part of this presentation, I'm going to go over the basics of the COVID-19 outbreak from the beginning, talk about transmission and symptoms of the SARS-CoV-2 virus that causes COVID-19, treatment and testing, prevention, the travel advisories set by the CDC, and the public health monitoring activities that the Department of Health is doing across the state. So starting off with the outbreak, the first update, as Donna mentioned earlier, the State Surgeon General, as well as the governor, declared a public health emergency at the beginning of the month to help us acquire the resources we need to respond. So this outbreak started, sorry, I'm going to turn the sound off so it stops doing that. Okay. All right, it's going back. So for those that don't know, this whole outbreak started off in Wuhan, China, which is in the Hubei province. Basically what happened is back in December, doctors and epidemiologists were identifying that there were people in this country that were being diagnosed with pneumonia and lower respiratory illness, and they did not know what was causing it. They were doing normal testing as they would for any respiratory disease. Nothing was being identified. So they started doing a little bit more digging, as we naturally should in a healthcare and public health setting, to see if we can find out what's causing all these similar illnesses. So they started asking people, what have you been doing recently? And so when they asked enough people, they started realizing a lot of them were linked to the seafood and live animal market in Wuhan. So they had been to that animal market at some point in that 2 weeks before their symptoms started. So in the beginning, we were mainly concerned at a global level that it was really those coming in direct contact with that market that were at the most risk. But as you all know, at this point, we're seeing this all over the globe, and that this is not just linked to exposure to that market, but now we are seeing person-to-person spread of this virus. And as of yesterday, because I think CDC probably has updated numbers right now, but at the time of when I put this presentation together a couple hours ago, the latest numbers were from yesterday from the CDC, which was 938 cases in the US, and then we have 26 cases identified now in Florida residents. We talked about it started in Wuhan, and then as Donna mentioned, the global case numbers are available in the World Health Organization situation report. And then in February was when the CDC identified that we had some community-based transmission first identified in the state of California. So going into transmission and symptoms, it's mostly being spread now person to person. This is not airborne, so those of you in the back are not quite as at risk if I were to have this disease. Donna's out of luck because she's within that 6 feet mark, so she's going to get it. So we're not as concerned about this being truly airborne. We know diseases like tuberculosis and measles, those germs can last in the air for a while. They're in really, really, really small particles that can stay suspended for a period of time. These, based off what we understand with this virus, those particles are not traveling very far. They're pretty heavy, they're weighted particles, so they're not really going more than 6 feet. Now, I guess there was a fan behind me blowing as I coughed and sneezed, then maybe that could go a little bit further, but that is not the average situation. We're looking at people being at most at risk if they're within 6 feet for a prolonged period of time to someone that has been diagnosed with COVID-19. So when we look at the incubation period for these new viruses, we basically start off at a 2 to 14 day incubation period, and that's what we've been looking at and has been pretty consistent so far with our investigations. And we're looking at primarily fever, cough, and shortness of breath or difficulty breathing as those main symptoms of this disease. However, because this is a new disease and we're taking in all kinds of information from people that are diagnosed, we continue to learn more about what the incubation period could be, what symptoms we are most likely to see, but as of right now, this is what stands. So with treatment and testing, there is no specific treatment, as Donna mentioned, for this time. It's mainly supportive care. So for those that have severe illness and they need to be hospitalized, they are cared for and isolated with the healthcare practitioners putting on the appropriate personal protective equipment, which what is recommended right now from the CDC is eye protection, an N95 respirator, a full body gown, and gloves. And so anyone that's diagnosed is making sure that we're taking those appropriate precautions to keep those healthcare workers safe. So with laboratory testing, the CDC did develop a test earlier this year for COVID-19. And then, as Donna mentioned earlier, we are having some commercial labs that are having this test available, which is significantly increasing our nationwide capacity to test people as we identify people that need to be tested. There are certain criteria that people have to meet in order to be tested through the Department of Health, as well as criteria that people can be tested through commercial laboratories. But it is more widely available now that those commercial labs are testing. So as we know, international travel or having close contact with someone with COVID-19 will put you at some level of risk. So those that have traveled internationally within the last 2 weeks, those are those identified areas on the CDC's website. We're telling them to take the appropriate precautions based off the travel advisories that CDC set forth. And one thing that's super important just to remember is that, as we've, I think, said 3 or 4 times now, rapidly evolving situation. This is constantly changing. We're getting updates all the time. So you can't necessarily hold me to what I say today about a particular guideline, because you could catch something on the evening news that talks about CDC's latest guidance. So we strongly recommend is that if you have questions, certainly reach out to us, but definitely keep an eye on the Florida Department of Health and CDC's COVID-19 websites, which I'll give those to you toward the end of the presentation. But that's what's going to help you stay the most up to date, is to keep up with what's going on and post it on those websites. All right, so if someone thinks they have symptoms and are at risk for COVID-19, the real important thing we're telling people is don't just blindly show up to your doctor or to a hospital or any kind of facility, healthcare facility, for evaluation. And the reason we say that is because we need that facility to be aware you're coming, so that they can take the appropriate precautions to make sure that their staff, other patients, and anyone else in the facility are not going to be also exposed to you. So it's super important to call them or call the health department. We will be sure to help coordinate getting you into the healthcare facility. Just that way we can ensure, again, as minimal exposures as possible are occurring in case you do have COVID-19 or someone you know has COVID-19. So avoiding contact with others, not traveling while sick, of course, covering your mouth and nose when coughing and sneezing. Just as a reminder, we're not coughing into our hands anymore. That is a no-no, because that's how you're going to cough into your hands and touch everything. Touch the doorknobs, touch the light switches, touch tables and chairs, touch pens. We can go on and on about all those things that you can touch and can expose yourself and expose others to. So it's really important that we're coughing into our elbow. So kind of that vampire cough, you want to cough right into there like that, and it does have pretty good coverage. Also coughing into tissues and then making sure you dispose of those tissues appropriately into the trash can, not on the floor or on the table. That way, again, there's preventing any potential exposure and transmission there. And then, of course, if you don't know, the leading, most cost-effective way to prevent the spread of disease is washing your hands. So that consists with washing your hands with soap and warm water for 20 seconds, especially after you're coughing, sneezing, or anything where it's involving your hands potentially coming in contact with your own secretions or with surfaces and things like that. So that's just something that you want to keep in mind. So prevention. So we kind of touched on this a little bit, but our main messages is that, good, adequate hand washing routinely throughout the day is important. In the event that you are not near soap and water, which that does happen every now and then if we're out and about, hand sanitizer, at least 60% alcohol is super important for to make sure that hand sanitizer is actually going to kill the virus if it gets onto your hands. So you can check that very easily on the bottle. It'll tell you what the percent alcohol is. Also avoiding touching the eyes, nose, and mouth, because those are areas of entry for the virus to get into your body. It's extremely important to watch out for your hands, because it's very second nature for a lot of people. You scratch your eye, you scratch your nose, you may bring your hand to your mouth to cough. We're trying to avoid that. So as we talked about, elbow bumps, knee bumps, foot bumps, any kind of bump with your body, just try to keep it away from your hands. And that's going to be the easiest way to prevent that spread of disease. And then, of course, as we mentioned earlier, please stay home if you're sick. I mean, we just don't want this disease, flu, chickenpox, any disease that's very easily transmitted from person to person. We don't want you to spread it. And it's especially with this disease, because it's such a new disease, and that older adults and people with compromised immune systems, if they do get exposed, they are at increased risk for serious complications and even death. So it's extremely important that we're all pushing that message as much as possible to not come into work or go to school, etc., when you're sick. So the travel advisories I wanted to point out. So as of today, you'll see on the CDC website that China, Iran, South Korea, and most countries in Europe are at a travel level 3 advisory or warning. So always keep up to date with that, because that's very important to make sure that you know what countries are at increased risk for that widespread and sustained transmission of COVID-19. As Donna mentioned earlier, Japan is at a level 2, and so they are not as high of a level. It's still of concern, and you should monitor yourself for symptoms if you do travel or someone travels from Japan for that 14-day period, but they're not seeing quite the widespread transmission happening in the other countries listed above. So again, as I said earlier, stay home if you're sick. So if you need to delay travel, please, reconsider traveling, especially on public transportation where you're in close contact with people you don't know. Traveling on airplanes, we want to be able to prevent exposures from occurring. We talked about covering your cough with your elbow or coughing into a tissue and disposing that tissue away. And then another thing I forget to mention earlier is after you cough or throw that tissue away is to practice hand hygiene. So that would be either that hand sanitizer or soap and warm water if it's available. Another really important thing we're discussing with the public, a lot of people are grabbing masks, and these are just the typical surgical masks you see patients wear. That is not the effective way of preventing yourself from being exposed. Those masks are made to prevent respiratory secretions from getting out of someone that's sick. That's not going to be the effective way at preventing yourself from then being exposed from someone that's sick. So we're trying to let people know that medical mask is not required if you are not having symptoms. But it's super important that if masks are worn, that they're being worn correctly. So making sure that you're following those guidelines and again, practicing good hand hygiene before and after putting on that mask. So I wanted to share with you what the CDC is providing to people that are coming in through those 11 quarantine stations. So as they come in, and if they're asymptomatic, they're given this form or this little flyer. On the front, it's in English, and on the back, it's in the native language of that country where they're coming from. And it basically tells them what the situation is, what they need to do. And it even has a section at the bottom right there that talks about what clinicians need to do. They can give this to a healthcare provider. If they don't speak English, they can give it to a healthcare provider and they can understand what this person's situation is and what they need to do, again, to prevent further exposures in their healthcare facility. So public health monitoring. So this is the life of epidemiology right now. This is pretty much all we're doing, and we're taking phone calls, we're consulting, we're monitoring people, we're focused on ensuring that this is occurring, and we're staying on top of everyone that's coming in from those countries with travel restrictions. So in the 67 county health departments, every county is doing these activities for people that come into your county or to the county from a highly impacted country. So we receive information from the CDC on a daily basis about individuals that are coming into various counties. And so we work with travelers to let them know they need to restrict their movement as much as possible, monitor for illness, and then isolate people that are symptomatic, and then making sure those healthcare providers that are seeing patients are engaging in those proper personal protective equipment and infection control procedures so that they don't expose themselves to the disease. So our process is to monitor people for symptoms for 14 days. So if they come back and they don't have symptoms, they should stay at home for 14 days until they have made it past that period. If they do develop symptoms, they really should stay away from other people as much as possible. And again, avoiding any kind of travel on public transportation or attending large gatherings. That way, if they are sick, they're not spreading diseases to other people. And then we are telling people coming from those certain countries that are highly impacted, or for those that are in close contact with a lab-confirmed COVID-19 case, that they do need to stay home from work, school, and other public places until that 14-day period has passed. And then if they do happen to develop symptoms, they call us, and then we work with them to get them tested if need be. All right. So it's just some different things to take into consideration. A lot of what we've already talked about before. If you are suspected or confirmed to have COVID-19, you're going to be isolated at home or at a healthcare facility, depending on what your current health status is. We're again telling people, do not, if you have this disease or think you have it, do not participate in those public activities and large gatherings. Only travel by ambulance or private car and avoiding public transportation, wearing a mask when you're around people and pets. As Alan mentioned, we have a service through the animal services that we're trying to help care for people that are diagnosed with this disease, to help protect their pets and take care of them while these people are contagious, because at the end of the day, we don't want while we don't know exactly how animals are really impacted by this, we certainly don't want to spread it to our pets as well. And then just as a reminder, covering those coughs and sneezes and using hand hygiene practices routinely are what's most important. So as of today, the immediate risk to Americans still remains low. More cases in the U.S. are likely to be identified. As you see in the Florida Department of Health and from CDC, we do continue to see more cases. So we are seeing person-to-person spread, so it's important to remember that this is, while it's not as airborne, it is still not difficult to spread if you're not engaging in the appropriate practices to prevent the spread of these diseases. And so everyone can do their part by going over and practicing those prevention messages I discussed earlier. So as I mentioned earlier, we have 2 websites, one for the Florida Department of Health and one for the Centers for Disease Control and Prevention. I can actually give you a little bit of a shorter link for the DOH one because it's kind of long. It's floridahealth.gov/COVID-19, and that is our main COVID-19 page. It has healthcare, provider resources, general community resources, education about the virus. It has educational posters and PSAs that you can print or post on your websites. Lots of good information is available at this website. And then you'll see that the CDC has their resource or their CDC page for COVID-19. So if you go there, as was mentioned earlier, it's very inundated with information. But there are various sections depending if you're worried about your business. There's a section to talk about what businesses can do. There's a section for healthcare providers. There's a section for homeless shelters, for schools, for childcare facilities. So CDC is working as hard and quick as possible to get those guidance documents out for different types of facilities to ensure that they can adequately prepare in case COVID-19 becomes a major concern in Seminole County, the state of Florida, and in the nation. And with that, I'm done. So thank you.
Don't go too far.
Yeah, I'm done.
All right, does anyone have any questions? Yes, sir. Oh, hang on a second. Ashley's coming back with a microphone. It's like Donahue. I just dated myself. Does anyone know Donahue? Donahue? Oh, good. Actually, I'm here. That's good.
Am I a celebrity now that I have a mic?
Yeah.
Do the scientists know that this is a latent virus?
So right now what we're focused on is the people that are showing symptoms of this disease. So essentially for someone to be released from this disease, so if they were tested positive, they do have to undergo additional screenings to be cleared of the virus before they can go back into the general public. So it is something that is still being looked into as we get more cases and understand the virus more. But we don't have an exact answer on that at this time.
So you can get the virus, you could feel better, but you don't know that you're going to get it again or pass it to someone else because it's latent. Is that correct?
So what we do know is, as with most diseases, there is going to be some level of protection immediately, and then we see that if someone gets infected with the disease, it's unlikely, unless it's a completely different strain, that they're going to get that infection again in the short term. But again, we're still learning more about the virus. This virus is only 3 months old, so to know how long that someone could really have the virus in them, we're still learning about that. That's why we're making sure that they have to have the appropriate testing performed to clear them if they're positive. That way we can make sure they're not spreading it to other people.
Okay. Thank you.
Other questions?
Ashley?
Here, I'll just,
Okay,
I'll
Ashley.
do this one.
Sure. For people that doesn't have insurance, what are you gonna do?
Sure. I'll give that one to Donna.
And now that we've traded microphones around,
I know.
grab it, make sure you go by one of our hand sanitizing stations as you leave.
Thank you for that, Alan, that commercial break. So we have been working very closely with our community health centers, and in fact just met with Shepherd's Hope recently, last week and again this week, because we want to make sure that they're prepared to help those who are underinsured and uninsured. At the moment, we're coordinating efforts for them to test either through the hospital laboratories or the commercial laboratories as they become more available here. But they do know to call us in the event that they have somebody that they suspect that could be infected, so that we can coordinate their care. So we are working on it.
But it's better to go straight to you than in the case?
Well,
that they
you would not want to come directly to the health department, but call the health department, because we don't have, the health department does not have primary care services. We coordinate the care, and True Health, as you may be familiar, is right there inside of our building. And that's the community health center that services the Orange and Seminole counties. So we will coordinate your care.
So here's the dilemma. If you've been exposed to, possibly to a coronavirus, or come in contact with someone who has, or have been in China, and within the 14 days, you can't find anywhere to go to seek any kind of medical help, even if you have insurance. And I understand that medical facilities are private practices for the most part. And to go to the emergency room, even with insurance, is $1,000 out of pocket. So there is this twilight zone where you can't get medical help if it's a non-emergency. And the other thing is, because I have extenuating circumstances that motivated me to look into this, I tried to call the health department and I couldn't get any clear answer of who to talk to. I kept getting forwarded to other phone numbers. And then today I called up and they wanted to know if I wanted to make an appointment. I just wanted to be able to see what options are available if you are in that situation. So.
Sure, so if you do have insurance, of course, your primary physician, so I would go to my primary physician. If you don't, contact the Florida Department of Health, and they can link you with one of the four, at least we know, four nonprofit and faith medical providers in Seminole County. But we can get with you after and make sure that your particular case is taken care of. But if anyone else knows of that, certainly call. If you're not, if you don't get a hold of them, call the Office of Emergency Management. We talk every single hour, and we will absolutely make sure that you're taken care of. So that's with anyone. So if you know of someone in your faith organization, I know I have some folks that I work with at different churches and such. But certainly if you have someone that needs assistance, we want to provide assistance, whether it's through the health department or through a private physician if you have insurance.
Well, this is my question.
Sure.
The assumption is a primary care physician would actually have the ability to test you. They don't.
So,
I don't know if it'll
so
make
I go to Newman Family Medicine. Newman Family Medicine, which actually takes care of some of our firefighters as well. Newman Family Medicine, we had that discussion yesterday with the doctors. They are sending people to a private lab where they are doing the testing. So they are doing that right now today. I can guarantee it because I went over the process yesterday.
Why couldn't I go to the health department and have them refer me to a private lab? Because first of all, I understand, okay, cutting to the chase, I was in China, the end of January. I self-quarantined for 14 days, blah, blah, blah. We had someone apparently who was on the flight from Wuhan, who apparently had been in quarantine, was okay. But you just don't know. So, you know, and I've been communicating to the airline I work for, trying to get them up to speed, but we've already been through SARS. We should have a game plan already. My suggestion is that we have telemedicine, and that, you know, you can communicate to somebody on the phone, because until you self-quarantine for 14 days, it's an interesting life, because you can't go anywhere. So the other suggestion I had is that you be able to go a drive-up window, like CVS Pharmacy, and get a swab test. But so far, you know, since January 28th, I have found no answers. And I'm here because I'm still trying to get someone to call me back, and I have left a message.
So we will
I'm
definitely.
trying to help. I'm not concerned for my safety at all.
Right.
I don't think I'm an issue, but
Right.
it's not working.
Well,
And
we do appreciate your comments and your feedback.
Okay.
It's very helpful. As we have mentioned several times, this is rapidly evolving, and we have communicated, I was just on the phone with the State Surgeon General this morning, communicating what our community needs are, and just that very thing, that
Thank you.
commercial labs are coming out with test kits, and we had hoped they'd be here sooner than later, but they're not quite there yet in this community. So right now we are, as Kevin mentioned, utilizing the CDC's guidance on those who are most vulnerable to exposure because of the limited test kits, unfortunately, right? But as the commercial labs and the private labs come on board, we will be able to test more widely. I will tell you that our community partners are working on several models, telemedicine being one, and then the others, of course, to provide more screening opportunities for our community, and that will happen shortly, within the next week or two. So I ask for your patience, as we work through this. Although SARS was also a coronavirus, it's a different strain, so we do have to develop new test kits and so forth. Unfortunately, those things are not readily available. That has to be done at the time that we identify the strain. So I do appreciate your comments. We will get with you and make sure that your needs are met.
And thank you.
So,
And
we also have
one comment that I had to say is that to me, it's not appropriate to go to your primary care physician because you're in the waiting room with other people.
Sure.
I just don't think that's the right path. I
Right.
think we need to go to some place specifically that's
Well,
a little bit more limited.
And that's why we do ask that you
Call
contact
ahead.
the health department first so that we can facilitate that visit. What we do is we call that office ahead of time. In this case, we've been calling the hospital ahead of time. If somebody is that ill that needs to go to the hospital, make sure that their workers are utilizing the appropriate isolation precautions as well as personal protective equipment so we don't risk exposing anybody else.
We have the gentleman here, there, then there. And then I'm gonna let everybody go, but we're gonna hang out, but the gentleman in the blue shirt, I don't know who has the microphone now. Ashley, do you have the microphone? Yeah, the blue gentleman in the blue shirt right there. Yeah, I'm talking about you. Oh, y'all have wipes now. Look at that. Can I have one for me? Go ahead.
Yes, we've been looking high and low, trying to get hand sanitizers for our residents. Can anybody give pointers in the right?
Sure, I can answer that question. We're emergency management, and our next delivery is late May, early June. So that is the situation we're currently in. So what I suggest is other cleaning solutions, right? Not just the Lysol, but other cleaning solutions. A bleach solution kills this particular virus, those types of things. So when don't just rely on the wipe that Ashley has, because you're not gonna find them. Right now, in some places you'll find, but they're rationing them, right? So I went to Publix, I think I went to 3 Publix, couldn't find a single one. Finally found one little box like that at Ace, and they only let me buy one. So we're in the same boat as you with the hand sanitizers. Remember, hand washing is priority. Hand sanitizer's a nice thing to have, but if you can get to wash your hands for 20 seconds, happy birthday twice, that's a lot better. And there's bathrooms everywhere, so we highly suggest that.
All right, thank you.
Yes, ma'am. We scared her with a microphone.
We're from a faith-based organization, and because there's no restrictions, what other options do we have for people that's vulnerable? I can use my husband, has an illness. What options are you recommending for people that are vulnerable attending? We are putting things into place, the fist bump or, just a nod.
Sure.
So what can you recommend?
So I'll talk about my church. So my church has said, please watch us online. They have a little place because a lot of my church are big tithers as well. So there's a place there where they can tithe if they wish to. But yeah, we've suggested those people with medical conditions go ahead and start doing that. And so we stream our services, and then we also have the services once they're streamed on Sunday morning. We put it on the website, and you can watch it later too. So that's what we've suggested. Instead of coming to the church, maybe that's, that's certainly an option. I don't know if y'all have any other options.
That would be
Yeah.
the same recommendation. You
Yeah.
know, those who are most vulnerable to complications, we advise to stay away from social gatherings where they may be more likely to be exposed.
Thank you.
Yes, sir.
So I guess the one question everybody wants to know, and just piggying off of what she was asking, so can you walk us through what somebody's supposed to do if they feel sick, but they don't know if they've got coronavirus, it might be something else? Should they call you? Should they go to the urgent care, the hospital? I mean, what should people do? What is the...
Call ahead before you go anywhere. So call ahead before you go to an urgent care, call ahead before you go to your primary physician, call ahead before you go to the Florida Department of Health.
But what will they tell you though when you call there?
So I called my doctor yesterday, and they said before you come in, of course they wanted to gown up. They wanted to get which is good. I'm glad that they said something like that. They wanted to get their personal protective equipment on. They said if they are going to test, they're going to send me, and they were going to send me to my doctor's office happens to be right next to a hospital that is doing the test, so that they would have sent me over to the hospital next door. So that's my physician. Everybody's. I don't know if you want to talk about if someone calls Epi.
Yeah, so Epi, we get the bulk of the calls. They're all coming to us to assess the situation. So essentially, if someone calls, they say that they've been sick, or they've had travel to somewhere where COVID-19 is spreading, or they've been in contact with someone with COVID-19. We basically go off of the guidelines that we have and set for the criteria that is set by CDC to determine whether the testing is then recommended through our state lab or through commercial laboratories. But ultimately, our thing is that you need to be evaluated by a medical professional. So the first thing we're going to say is, do you have a primary care provider and insurance? And then we want to try to find out where they want to go. So if they need to go to a federally qualified health center, or if they need to go to their PCP, or if they're in really bad shape and need to be seen at a hospital, we're going to get that information, reach out to that hospital, let them know that they need to set up an appointment and go there, and then make sure that they have everything they need at the facility to protect themselves, protect the patients. That way, when they go, any kind of exposure would be extremely minimal.
And I'll just add, because I know testing is a concern. So as the commercial test kits become more available, and we're told in speaking with both LabCorp and Quest and others, that this should be very quickly, like within the next week, the doctor can write an order. So when they go to get their medical assessment from their private provider, taking the precautions that we mentioned, if the doctor feels that they want to test them as part of a respiratory panel, they're going to have the ability to do that. But we are waiting for those commercial labs to become more available.
All right, so we're a little over, so we're going to hang out. Thank you all very much for attending today. If you have any other questions, feel free. Very happy to answer. You can come up and ask.